Hi, I'm Haley Coleman, and this is my Educated Citizen Portfolio presentation. So the issue that I've chosen to focus on is the abuse and neglect of disabled children. So research this semester, I found that an estimated 17,254 children in Nebraska have disabilities, which I think is a very large number considering, the size of Nebraska. I found a study through DHHS that found that children with disabilities are actually 3.76 times more likely to be neglected, 3.79 times more likely to be physically abused, and 3.14 times more likely to be sexually abused. This issue is important to me because I work at a respite care center, a pediatric respite care center. I work with kids that are either really medically complex or have some sort of disability, whether it's a genetic condition, a developmental delay. I work with a lot of children that are nonverbal or have very limited communication. So this lends itself to being a very vulnerable population, and they often struggle to or are unable to advocate for themselves. So I really just believe that this is a population that needs a little bit more support. There is a great need I found in the community for education among children with disabilities and their caregivers as well. So throughout my time at Methodist, I have had many opportunities, and I've recently been able to reflect on these opportunities and just discover what I've learned about being an educated citizen through these experiences, as well as how they relate to the public issue of abuse and neglect of disabled children. So, the first experience I'm going to talk about was during my freshman year. It was during clinical. I was assigned to take care of a patient who recently had a tracheotomy, so he was nonverbal. I was following around my nurse, and he had his call light on. We went into his room and started talking to him, and he was clearly in distress. He was sort of gesturing and restless. We could tell that he needed something, but he couldn't verbally tell us because of this tracheostomy. So we tried having him write things down. We tried trying to have him nod yes or no to things, and it really wasn't working. My nurse was getting frustrated. She left the room at one point. I took a paper and I wrote a couple things down, like food, water, bathroom, cell phone. And he actually eventually was able to point to the one that he needed, and we were able to get him the things that he needed. So, what I learned in this experience was really that communication is flawed. Up until this point, I didn't have much experience with difficult communication or struggling with communication. Um, I learned that it's complex and imperfect, and it can be really confusing and frustrating. It wasn't an easy lesson to learn. I felt so bad for this guy. I was almost in tears. It was frustrating, and I wanted to get him what he needed. I also learned that effective communicators are able to combine different forms of communication, like verbal, nonverbal, and written, to meet their patient's specific needs. It felt really good eventually to be able to get this man what he needed. As far as applying it to my public health issue, or public issue, excuse me, working with nonverbal patients in the future, I could use this experience to combine verbal, nonverbal, and written communication to meet the needs of children who maybe struggle with verbal communication, like this man did. So the next experience occurred during my postpartum clinical, a little bit further down the road for me. This experience, the patient I was assigned to she had birthed her baby about a day before, and we were on the postpartum floor. She had a lot of questions about caring for her baby. Most of them were related to bathing. And I just remember trying to answer her questions, but she really was exhausted. And I could tell she wasn't retaining any of the information. So I had an idea to make her a handout. So that's exactly what I did. I made a handout with a bunch of just facts and informations about bathing a newborn, and I was able to give that to her, and I could just see the relief on her face when I gave that to her because she could refer back to it, and she didn't have to focus on learning all this new information at once. So what I learned from this was the importance of recognizing nonverbal communication, like realizing this lady was just too exhausted to learn things. She was yawning, she was practically falling asleep while I was talking to her. And I also learned the benefits of written communication. I don't think I realized it up until this point how important and useful written communication could be, because I was never one to really want to read things per se, read books, but having this handout for this lady, she could refer back to it and not have to depend on her memory. I think that was really helpful. So in the future, I think when working with kids with disabilities that possibly were abused, I can use more than just verbal communication. I can use written and nonverbal communication to work with these kids and to teach them their advocacy skills. So maybe if I'm teaching like coping skills to a group of children who have been abused, I can write these down so they don't have to depend on their memories. So another experience I had was working as a summer camp counselor. I worked with a camper who had degenerative eye disease. So she was going blind. And at the beginning of the week, she really was struggling with not being able to keep up with her peers and just being really down on herself about not being able to do things exactly the same way. So I had to get pretty creative when I was working with her. I added a reflective sheet to the archery target so she could see them. Um, I printed everything in the cabin. We had signs in there because it was COVID. So I printed everything in some really large, bold print. We did activities in the cabin like friendship bracelet making because once she learned a pattern with her hands, she could do it on her own, and that really connected her to her peers. And she just ended the week so much happier, and I think she's really got a lot out of it. So the lessons I learned was that a reflective individual can use critical thinking and creativity to solve problems. Like in this situation, doing all those creative things like adding the reflective sheet to the target, it was thinking on my feet and being flexible, knowing that this activity is not going to look exactly the same for everybody, but in order to help her be successful, it needed to be done. So we just needed to be creative. I can use this in the future. I can use skills like critical thinking, creativity, and flexibility when I'm working with children with special needs or disabilities to adapt abuse education that I think needs to be given to kids so they can protect themselves, but it may need to be adapted to meet the needs of the specific child, whether it's printing a braille sheet for a blind child or getting a sign language interpreter for a deaf child. Another experience I had occurred during my geriatric clinicals recently. This experience, I honestly had a poor attitude going into. I didn't really understand why I needed more geriatric clinicals, but I was given the opportunity to spend a couple days at a rehab facility working with the clients there, and it really was a, like attitude check for me. I helped older people tie their shoes. I helped them wipe their mouths when they couldn't swallow their pills all the way. I changed briefs. I did things that come easily for me and that I know most of these people were mentally intact, and I just was imagining how it must feel to have your own body failing on you. So the lessons I learned in this were engaging in a habit of inquiry helps me to identify my negative thoughts and my attitudes and to evaluate them. I learned that reflective individuals take personal responsibility for their own attitudes and actions, and I'll be able to apply this to my public issue because I know that abuse of disabled children is a sensitive topic. Nobody wants to think about children in that category being taken advantage of, children at all. And it might be hard sometimes I might have feelings that maybe would impact the care that I would give the child, but being able to engage in habits of inquiry and take personal responsibility will help me to evaluate these feelings and really make sure I don't let them impact the care that I'm giving the children. Another experience I had was during my freshman year, another med-surg clinical. I told a patient, "Bless you," after he sneezed. And he got very upset with me and offended. And he told me I was being ridiculous and just berated me for saying a thing that I feel like a lot of people say out of habit. I had a conversation with him and asked him why he felt such a way, and he sort of broke down and talked about his loss of faith and the struggles he'd been through recently. And it was hard, I'll admit, for me to bite my tongue at times because I didn't understand at the time why I was being yelled at for saying something that I thought was nice. But I learned this lesson of cultural competence and just knowing that people believe different things and it's okay. I can use this in the future to be better advocates for victims of abuse and neglect that come from any background, whether they believe what I believe or believe something completely opposite. Having this cultural competence will help me to be a better advocate for these children. And then finally, another experience I had being a change agent was I started a new job, and I'm a very quiet and reserved person. I was feeling really apprehensive about sharing new ideas. They were looking for ideas to improve the workplace, and I had ideas, but I I couldn't get myself to share them. I thought that I didn't know what was going to happen, but I was not willing to share them. But after a while, I realized that I wasn't doing any good by just staying quiet. So I decided to speak up and I shared an idea, and it actually started sort of a new experience for people who were quiet like me. I got like a suggestions box and got that into place so that people didn't have to really speak up like I did, and they could put their suggestions in the box, and a lot more started to get done in the workplace. So I learned that change can be uncomfortable, but change agents initiate and enact change for the greater good. So I can use this in my future, working with patients that may have disabilities and have been abused, because I don't think I'll ever be comfortable. I don't think that's a situation where anybody should become comfortable because it's just so volatile. So I think even though I'll never be comfortable, I should still be able to push myself out of my comfort zone and enact any change that needs to be put in place in order to give my patients the best care possible. So to finish up, um, I have learned throughout my time at Methodist that the educated citizen combines the qualities and the skills of the effective communicator, the reflective individual, and the change agent to be truly the best nurse that they can be. I think I have grown so much the past 4 years, and I've learned that it's not always comfortable, but I have become just such a different, more expanded, more knowledgeable, sensitive, empathetic version of myself. I've learned a lot about my community and the nurse that I hope that I can be someday. In learning about my community, I have learned a lot about the public issue that I chose, as well as many other public issues that are existing within it. I think being aware of these issues gives me so much knowledge that I can pass on to my future patients and hopefully help with each of these issues, even if just a small way. I hope that I can use all of my educated citizen little goals and techniques and really be able to give my future patients the best care possible. And here are my references. Thank you for listening.